Hello and welcome to the web seminar on improving joint replacement margins through a margin analysis team. I am Joe Tamaro and I am the Senior Vice President at Accelero Health Partners. I will serve as the moderator for this web seminar. Joining me today are Bruno Capella, a Senior Director at Accelero Health Partners, and Val DeJoseph, Administrative Director of Business Development at Shore Medical Center in Somers Point, New Jersey. There is no doubt that the current trend is for declining reimbursement for hospitals. Because of that, hospitals today more than ever must be diligent at managing both the revenue aspects and the cost aspects of their margins. The purpose of this case study is to show how one hospital created a structure to implement margin improvements across the musculoskeletal service line. A critical success of this initiative was involvement of their physicians. This chart shows the Medicare relative weights for two key major joint replacement DRGs. The relative weight, along with the base rate, determines a hospital's Medicare payment for that DRG. The most common DRG for joint replacement is DRG 470. As you can see from the chart, the relative weight of this DRG increased slightly from 2008 to 2011, but decreased from 2011 to 2012. This trend has led to a stagnation of joint replacement reimbursement for hospitals. As we look at the trends in our OrthoVal All-Partner database over the past 6 years, it is apparent that the increase in the net revenue per case for joint replacement patients is slowing down. However, if variable costs are effectively managed, joint replacement cases can still bring a substantial margin to hospitals. In addition, since joint replacements are a relatively high volume procedure and have a relatively low variability as to patient care, they are being targeted by many payers for bundled payment projects. This is yet another reason to understand all margin elements and effectively manage them. Bruno, Horizon Blue Cross and Blue Shield of New Jersey is doing a unique bundled payment pilot. Can you tell the audience a little bit about it?
Sure. Horizon is the most dominant payer in New Jersey, second only to Medicare, in joint replacement. Horizon actually formed Horizon Healthcare Innovations to manage the bundled payment project. Similar to the CMS demonstration projects, Horizon is also looking to move ahead with a bundled payment specifically in joint replacement. The biggest difference is that they've engaged the surgeons first, and the hospitals haven't really had a dominant role in the project or seat at the table so far. There were 5 surgeons selected for the initial project. One of those surgeons is actually at Shore Memorial, and he's the highest volume surgeon. It's a multi-phase project, and the actual bundling of the payment and whom will control that payment has yet to be determined. We're really looking at 2012 or 2013 for further definition.
Most recent bundled payment projects not only look at the hospital stay, but consider a 30-day window preoperatively and up to a 90-day window postoperatively as components of this episode of care definition. For total joint replacements, the hospital stay accounts for 75% of the total cost. The key takeaway here is you need to manage the hospital stay right now, knowing that future payment methods may expand this episode of care definition. It is my pleasure to welcome Val DeJoseph from Shore Medical Center. Val, can you provide some background information on Shore Medical Center and your role there?
Thank you, Joe. I'm the Service Line Director for the Advanced Spine and Orthopedic Institute at Shore. We are a 296-bed non-for-profit hospital, community hospital with renowned affiliations from Philadelphia, including the University of Pennsylvania, Children's Hospital of Pennsylvania, the Rothman Institute, and Jefferson University Medical Center. We do approximately a musculoskeletal volume of 2,100 cases per year. 1,200 include inpatients and about 900 outpatients. In joints, we do 350 cases, growing about 5%. In spine, we're doing 600 spine cases in combination with in- and outpatients. Sports medicine, our outpatient volume is about 260 cases a year. Most recently, I'm very excited to announce the grand opening of our new $125 million surgical pavilion and campus expansion. Also at Shore Medical Center, we are also a proud member of the Plaintree Network, which focuses on patient-centered care with holistic approaches for patients and their families.
Thanks, Val. At Shore Medical Center, between 350 and 400 joint replacement cases are performed annually, with a large majority of these cases performed by one surgeon. However, over the past 6 months, physician engagement strategies have been employed, and additional surgeons are now performing joint replacement cases at Shore Medical Center. 18 months ago, Accelero did an analysis of the musculoskeletal service line at Shore Memorial. The chart shows the mean and benchmark information for joint replacement financial indicators across our partner database. Shore's net revenue per case, while not shown on this slide, was below the mean, and their variable cost was well below the mean. This led to a contribution margin that was moderately below the mean throughout the Accelero partner database. One of the first places to look for cost opportunity is length of stay management. 81% of Shore's total hip and total knee replacement patients had a length of stay of 3 days or less. This placed them near the 75th percentile for length of stay management among Accelero partners. So while there is still some opportunity with length of stay management, a lot has been done over the past few years at Shore Medical Center to effectively manage length of stay for joint replacement patients. Val, could you comment on some of these length of stay initiatives that you have done as a group?
Primary focus has been on joints. We have a dedicated team that's structured who understands how important the pre-op education class and takes a lot of pride in the teaching aspect to our patients and their families. We remain disciplined with the order sets and pathways. We are also very fortunate to have a dedicated surgeon whose goal is to have a 3-day length of stay or less, and this all contributes to a good and consistent length of stay.
Bruno, as you started working with Shore, you recognized the need to do everything possible to optimize their margin. Describe the makeup of the margin analysis team.
Thanks, Joe. Valerie talked a little bit ago about the structure they had in place for joint replacement, and they also had a surgical spine team in place. As we were reinforcing their service line infrastructure for the entire program, we also created a dedicated margin analysis team, really responsible for the entire service line. The initial focus was solely on joint replacement. Here are the key resources that are typically selected to be part of this team. Val, can you speak to a little bit about the folks that we had on this particular team and why they were so instrumental in making headway in reducing costs?
Sure, Bruno. Let me start with the Director of Materials Management. Working with him has helped us tremendously. He's been transparent with the products and costs and understands how important the right product and the safety is to the patient. He is responsible for the entire organization at Shore, and we work as a team. He's not threatened and feels we are working together for the best care of the patients. Another key member of the team is the Administrative Director of Surgical Services. We communicate on a daily basis. She's a key resource and has the mentality and discipline to provide the best care. It's all about building relationships and trust with your team. That is key.
The most critical step in margin analysis is having data. Without data, it's like driving a car without a steering wheel. Getting your hands on all of the critical data is what helped to point this team in the right direction. We started off by looking at variable cost at a joint replacement procedure level for 2 reasons. Number one, we needed to understand where Shore's costs were exceeding the Accelero means and benchmarks. And number 2, we also needed to understand the variable cost by surgeon. Even before we started our deep dive into the data, it was important for the entire team to leverage OrthoVal to understand the current variability by surgeon. This chart depicts the cost variance for the top 4 joint surgeons at Shore. There's about a $1,000 difference between the highest and the lowest cost surgeon. Val, before this initiative was started, what was the process at Shore to understand and manage costs by surgeon and/or procedure?
Before our partnership with Accelero, we had no process in place. However, we did know there's variabilities in surgeons, but were they providing the same level of care? We looked at the cost as an aggregate along when we started our partnership. With Accelero, we stepped it up in more detail by surgeon level. For example, we looked at the OR times, the sutures cost, and the length of stay piece.
Having this level of knowledge really helped to guide our team when we were ready to pull the detailed data. Accelero provides our partners with a very prescriptive data request template to pull case-level cost data. At Shore, Tim Hanlon, our planning analyst, was really instrumental in helping to provide us with the